I do a broad range of people. I would say about 75% are women, about 25% are men. Age-wise, I've done people who are 17 years of age, all up to age 76 was the oldest I've done. Area-wise, typically in women, it's all over the place. Outer thighs, inner thighs, certainly the abdomen, the waistline, the flank and hip area, the back is a very common area to do. The arms are a wonderful area in women to do. In men, the common areas are probably the flank area, number 1, the love handles. Number 2 is probably the abdomen. Number 3 is the male chest, gynecomastia. And number 4 is the neck. On my website, there's a part called Area by Area where I talk about specifically how I approach every single area of the body and what I've learned over the years and many of the pitfalls and mistakes that other surgeons fall into. But there's certain areas I call gravitationally prone, like the arms, the inner thighs, the neck area. With time, they start to get worse. And if you catch them with lipo, you actually will get the skin to lift up and tighten, and it's not only in the short term looks much, much better, but there's the advantage of prevention that long term it tends to stay tucked up, because you've reduced the weight of the fat on the skin and you're also creating connective tissue that's supportive. In certain areas like the arms, if a woman catches it early, it's not going to drop as much with time, because at some point she's going to have lost so much elasticity that it's going to get too loose, and then lipo may not be an option because if there's too much loss of elasticity, and the only option becomes a surgical arm lift, which leaves a horrific scar. Same thing applies to the back also. Same thing applies to the neck. If you catch it early in somebody's 20s, 30s, or 40s, before it drops too much, it can many times delay or prevent the need for a facelift procedure by tucking that area up. I also do a lot of areas that other surgeons don't do, which are much more difficult areas to approach, such as the calves and ankles, such as the anterior thighs, such as rarely the buttock itself. You just have to approach a little bit differently with liposuction to get proper skin retraction in the area. So those are some of the differences I've seen.